Good afternoon, everyone. We are going to call the meeting for Health and Human Services to order. We will be doing decisions today, and I will pass the mic over to Ms. Naomi Kamara.
Thank you, Mr. Chair. So we're going to hold on a few items that'll be heard in the full committee, but we will start with the white packet with the Office of Deaf and Hard of Hearing.
Thank you. Starting on page 1, number 1 is to delete 1 vacant position and associated funding in the Office of the Deaf and Hard of Hearing. The agency disagrees, maintaining that all positions are critical and plans to fill that position by the end of fiscal 2026. The number 2 is to adopt committee narrative, requesting 2 updates on state sign language interpreter licensing requirements. There is a modification in the blue packet on page 1 that amends that to restrict $50,000 until those requirements are published. And then on page 2 of the blue packet, there is an additional item to restrict $50,000 until the Office of the Deaf and Hard of Hearing submits a report on the status of vacant positions.
Adopt color page blue, number 2.
Moving back to the white packet, on the Department of Disabilities on page 3, DLS recommends concurring with the governor's allowance, and the agency concurs.
Move to adopt.
On page 4 of the white packet, for the boards, commissions, and offices, the DLS recommendation is to concur with governor's allowance, and the agency concurs.
Move to adopt.
Page 5, the Secretary of State, the recommendation is to concur with the governor's allowance, and the agency concurs.
Move to adopt.
On page 6 for the Maryland Department of Aging, recommendation 1 is to reduce funds to increase the turnover expectancy to 8%, and the agency concurred with the federal fund reduction but does not support the general fund reduction.
I would move to modify by rejecting the general fund cut and adopting the federal fund reduction.
The second recommendation on this page is to adopt narrative requesting a report on the implementation of the SOAR program, and the agency concurred.
Move to adopt.
On page 7, recommendation 3 is to adopt narrative requesting that the agency create managing for results measures for the SOAR program, and the agency concurred.
Adopt.
Moving to page 9 for the Maryland Commission of Civil Rights. On number 1, DLS recommends adopting narrative on measures implemented to reduce case backlogs, and the agency concurs.
Move to adopt.
Moving on to page 11, the Military Department. The first recommendation is a committee narrative requesting a report on the submission of the MFR measures for TRICARE premium reimbursement program. The agency did not respond.
I'd move to adopt, and I think, Mr. Chairman, there might be additional language that I want to consider on page 3.
Yes, it's on page 3 of the blue packet. This is a narrative requesting a report on the FCA reopening and facility renovations.
I'd move to adopt color page 3.
I'm sorry, I would like to correct that. That is a language restricting $500,000 pending submission of the report on FCA reopening and facility renovations.
On page 12 of the white packet in the Maryland Institute for Emergency Medical Services Systems, DLS recommends concurring with the governor's allowance, and the agency concurred.
Move to adopt.
On page 13 for the Maryland Health Benefit Exchange, the recommendation is to adopt narrative requesting a report on the reinsurance and state subsidy program costs and forecasts, and the agency did not respond.
Move to adopt.
On page 14 in the West North Avenue Development Authority, DLS recommends adopting narrative requesting that the agency work with DBM to program anticipated spending in next year's budget, and the agency concurred.
Move to adopt.
On page 15 for the State Department of Assessments and Taxation, item 1 deletes one long-term vacant position, and the agency disagreed.
Move to adopt.
Item 2 restricts funds pending a report providing a status update on a major IT project, and the agency concurred.
Move to adopt.
Flipping now to page 17 for the Property Tax Assessment Appeals Board. Item 1 requests a report on the number of vacancies and backlog cases for local boards, and the agency concurred.
Adopt.
Turning now to page 4 of the blue packet. This item restricts funds pending a report on how the agency is moving away from paper-based processes.
Move to adopt color page 4.
On page 18 in the Maryland Department of Health Administration, DLS recommends adopting narrative requesting a report on staffing at state hospital facilities, and the agency concurred.
Adopt.
There's an additional page for your consideration of page 5 of the blue packet, which would restrict funding pending the submission of a report on staffing at the JLG RICA facility.
Adopt blue color page number 5.
Adopt blue color page number 5.
On page 20 for the Office of Healthcare Quality, the DLS recommendation is to concur with the governor's allowance, and the agency concurs.
Adopt.
And I also have 2 additional pages. I have 2 additional pages for consideration. First, on page 7 of the blue packet. This adds language restricting funds pending a report on the long-term care program complaint investigation backlog.
Move to adopt color page 7.
On the next page, page 8, this adds a language restricting funds pending a report on the Montgomery County MOU for survey activities.
Adopt color blue color page 8.
On page 21 of the white packet, for the health professional boards and commissions, our recommendation 1 is to adopt narrative requesting that the number of total licenses and complaint rate for the Board of Nursing be included in their MFR submission, and the agency concurred.
Move to adopt.
Adopt page 21, number 1.
The second recommendation is to adopt narrative requesting a report with updates on the Board of Professional Counselors and Therapists evaluation recommendation. The agency concurred, however, I do have an additional page for your consideration on page 9. This additional page modifies this recommendation to be language restricting funds pending the submission of the report instead of narrative.
Move to adopt and then adopt color page number 9.
Adopt color page 21, number 2, and adopt color page number 9.
And then I have 2 additional items for consideration in the blue packet. On page 11, this adds language restricting funds in the board restricting funds pending a report on the fund balance transfer, the impact of the fund balance transfers from the boards.
Adopt page 11.
Adopt color page 11.
On the next page, page 12, this adds language restricting funds pending the submission of a letter confirming the submission of regulations related to prescription labels in the Board of Pharmacy.
Adopt color page 12.
Adopt color page 12.
On page 24 of the white packet, under the Public Health Administration, DLS recommends concurring with the governor's allowance, and the agency concurred.
Move to adopt.
Adopt page 24, number 1.
On page 25, under the Prevention and Health Promotion Administration, DLS is recommending amending the budget language to align with BRFA language that reduces a mandate for tobacco cessation programs and also increase the amount of the contingent reduction in the budget to meet the proposed amount of the mandate.
Move to adopt.
Adopt page 25, number 1.
There's an additional page on page 13 of the blue packet under the Prevention Health Promotion Administration, which would restrict funding pending a report on screening and treatment of certain health conditions in children.
Adopt color page blue number 13.
Adopt color page number 13.
Moving back to the white packet on page 26, in the Behavioral Health Administration, the first recommendation is to reduce funding to reflect a higher vacancy rate than is assumed in the budget. The agency disagreed. Bless you.
Thank you.
We're allergic to that too. Move to reject.
Reject page 26, number 1.
Recommendations 2 through 4, as well as recommendation 11 on page 38, restrict funds to 3 BHA programs and 1 program in Medicaid, and the agency concurs.
Move to adopt all 4.
Adopt 2 through 4.
Recommendation 5 on page 28 restricts funding pending the submission of a report by the Office of Legislative Audits confirming corrective action taken by the Department of Health to address repeat audit findings.
Move to adopt.
Adopt page 28, number 5.
Recommendation 6 on pages 29 and 30 restricts funding, pending the submission of fiscal 2028 budget with the provider reimbursements in the community services program budgeted separately from the rest of the community services program. And the agency concurred but did not agree with the restriction.
Move to adopt.
Adopt number 6 on page 29 through 30.
Recommendation 7 on page 31 and 32 restricts funds pending the submission of non-Medicaid provider reimbursement data, and the agency concurred.
Move to adopt.
Adopt number 7 on page 31 and 32.
Recommendation 8 on page 33 and 34 restricts funding pending the submission of a report on the timeliness of grant payments to local CSAs. The agency concurred but requested a later due date of January 1st.
We'd like to adopt but modify and allow the agency to have a later due date. So modify by an extended due date.
Modify number 8, page 33 through 34.
Recommendation 9 on page 35 would be to adopt committee narrative requesting a report on the transition to the new administrative services organization.
Do you mind if we just hold this, Mr. Chairman?
Yes, sir.
On page 36 and 37, recommendation 10 is to adopt narrative requesting a report on reimbursable fund spending in the behavioral health Medicaid program. Again, the agency concurred but requested a due date 1 month later, August 31st.
I move to modify just to allow the agency an extended due date.
Modify number 10 on pages 36 to 37.
Now turning to the blue packet, there are a couple other items for your consideration. On page 15 of the blue packet, this is a narrative that would request a report on financing options for long-acting injectable medications.
I move to adopt color page number 15.
Adopt color page number 15.
On page 16 of the blue packet, this budget language restricts funding for the use of supporting the certification fees and internship hours of peer recovery specialists.
I'd move to adopt color page 16.
Adopt color page 16.
And then on page 17 and 18 of the blue packet, this is, excuse me, this is language restricting funding pending the submission of a report on MDH's efforts to strengthen the behavioral health workforce.
I'd move to adopt color pages 17 and 18, which is just the continuation of the language.
Adopt 17 and 18.
And so now we turn to DAs. You just say we're going to hold on.
Okay. Colleagues, we're going to hold all the DDA items just to make sure that it goes to full committee.
Okay, so that would take us to the Medicaid items that begin on page 45 of the white decision document. The first DLS recommendation is to reduce a total of $8 million, $3 million in general funds in anticipation of more Medicaid participants shifting to Medicare who have end-stage renal disease. The agency disagreed.
Move to adopt.
Adopt.
The second item would add contingent language, making funding contingent on a BRFA provision. MDH concurred.
Move to adopt.
Adopt page 45, number 2.
Items 3 and 4 are annual language that restricts funding in Medicaid and the Maryland Children's Health Program to that purpose, but allows some transfer to Medicaid Behavioral Health Services, and the agency didn't respond to either.
Move to adopt number 3 and 4, which is just annual budget language.
Adopt 3 and 4 on page 46.
Item 5 is language that restricts funds pending a report on community first choice, the community options waiver. I will draw your attention to page, page 21 of the blue packet. This language would modify it to restrict $250,000 and include information requests on the eligibility determination division.
Mr. Chairman, I would move to just modify it by adopting color page number 21.
Modify page number 5, page 47, and adopt color page 21.
So then on page 49, DLS recommendation number 6 restricts funds pending a letter from OLA on the completion of certain corrective actions for the Medicaid's most recent audit.
Move to adopt.
Adopt number 6 on page 49.
And then on page 51, item 7 is a technical recommendation to remove some of the language on a contingent reduction, and the agency concurred.
Move to adopt.
Adopt number 7 on page 51.
Item 8 is similar. It's a technical correction to remove the same language from the contingent special fund appropriation. The agency concurred.
Move to adopt.
Adopt.
Item 9 on the bottom of page 52 is narrative that would request a report on One Big Beautiful Bill Act implementation. The agency concurred.
Adopt. We can't change the name of the One Big Beautiful Bill, can we? Anyway. Move to adopt. Sorry.
Adopt number 9, page 52.
On the bottom of page 54, there's a recommendation to reduce the deficiency for Medicaid by $10 million in general funds and $70 million total funds. And that would be to account for claims paid for prior years. The agency disagreed.
Move to adopt.
Adopt number 10 on page 54.
And then item 11 on the bottom of page 55 recommends reducing the deficiency for 2026 claims due to the medical loss ratio recovery, and the agency disagreed.
Adopt.
Adopt number 11 on page 55.
There are a few items in the blue packet. So the first one I'll draw your attention to is item 19, or page 19. This is language that expresses intent that a work group be formed on nursing home performance, and then it restricts funds pending a report.
Move to adopt color page number 19.
And it continues on to page 20.
19 through 20. Move to adopt.
Just checking to see if it said Jennings on the work group.
No, I got on that task force there before you saw that.
I did. Adopt color page 19 and through 20.
Okay, and then back to the white decision document on page 57 for the health regulatory commissions. The first item is also a technical correction, removing certain language from the contingent reduction. The agency concurred.
Move to adopt the technical correction. Move to adopt the technical correction.
Adopt number 1, page 57.
And then item 2 on page 57 would be narrative, requesting a report on primary care programs and initiatives under the AHEAD model. The agency concurred.
Move to adopt.
Second.
Adopt number 2 on page 57.
And then on the blue packet on page 23 and continuing on to page 24, this is language that would restrict funds pending a report on the AHEAD model and specifically Medicare Advantage market stabilization.
Move to adopt colored pages 23 through 24.
Second.
Adopt color pages 23 through 24. Dealing with Medicare Advantage.
And Mr. Chairman?
Yes, sir.
I just wanted to thank Senator Jennings for his leadership on this as well.
I double that.
Moving back to the white packet on page 59 for DHS administration, DLS recommendation 1 is to reduce the fiscal 27 appropriation for CJAMS and CSMS to more closely align with anticipated ongoing costs. The agency disagrees, maintaining that additional funds are needed for ongoing work on the applications.
Move to adopt.
Adopt number 1 on page 59.
Recommendation number 2 is to restrict $750,000 until DHS submits a report on the fiscal 26 working appropriation. The agency concurs in part. They request to move the due date to December 15th of 2026.
Move to adopt.
Adopt page 59, number 2.
Number 3 on page 61 adds language to reduce funding for the Constituent Services Call Center that allows the agency to allocate it across programs. DHS disagrees, maintaining that the funding above the contract cost is needed for service improvements.
Move to adopt.
Adopt number 3, page 61.
And then on page 62 is adding language to the Office of the Secretary, reducing the special fund deficiency for the Constituent Services Call Center due to lack of availability of EUSP funds and it being above what the agency anticipates is needed for the contract. The agency disagrees.
Move to adopt.
Adopt number 4, page 62.
DHS Social Services Administration starts on page 63. The first recommendation is an annual language restricting general funds appropriated for child welfare services program to that use only. The agency concurs with the recommendation.
Move to concur.
Adopt number 1 on page 63.
Recommendation 2 is an annual language restricting general funds appropriated for foster care maintenance payments to that use only. The agency concurred with the recommendation.
Move to adopt.
Adopt number 2 on page 63.
Recommendation 3 on page 64 is a language restricting funds pending submission of data related to Child Welfare League of America caseload standards. And DHS concurred in part. They request the due date be moved to December 1st, 2026.
Move to adopt.
Adopt number 3 on page 64.
On page 66, recommendation 4 is a language restricting funds pending submission of a report on children and youth in out-of-home placements experiencing stays in hospitals, hotels, and other unlicensed settings. Agency requests the due date be December 1st, 2026.
Move to adopt.
Adopt number 4 on 66, going to 67.
Recommendation 5, starting on page 69, is a language restricting funds pending submission of a report from the Office of Legislative Audits confirming audit findings were corrected by DHS. DHS concurs with the recommendation.
Move to adopt.
Adopt number 5 on page 69.
Recommendation 6 on page 70 is a language restricting funds pending submission of a letter confirming child welfare services data has been updated on DHS website. DHS concurred with the recommendation.
Move to adopt.
Adopt number 6 on page 70, going to 72.
Recommendation 7 on page 73 is a language restricting funds pending submission of a report providing costs associated with children and youths in out-of-home placements placed in hotels. DHS concurs in part. DHS reported that fiscal 25 actual expenses lacked standardized documentation and are not available. DHS also requests the due date be December 15th.
Move to adopt.
Adopt number 7 on page 73.
Recommendation 8 on pages 74 and 75 is a language restricting funds in DHS and MDH pending submission of a letter confirming the Medicaid state plan amendment has been submitted. The agency disagrees with the recommendation.
I would move to modify by increasing the amount that's being restricted to 200,000.
Second.
It was modifying it from 100 to 200.
Adopt the modification for number 8 on 74, going to 75.
Recommendation 9 is a committee narrative requesting an update on implementation of provisions of Family First Prevention Services Act. The agency concurred with the recommendation.
Move to adopt.
Adopt number 9 on page 76.
Recommendation 10 on page 77 is a committee narrative requesting report on child fatalities. The agency concurred.
Move to adopt.
Adopt number 10 on page 77.
Recommendation 11 on page 77 and 78 is a language restricting general funds appropriated for foster care maintenance payments that is provided through deficiency appropriation to that use only. The agency disagreed. DHS notes that this prevents funds remaining after federal match from being reinvested.
Move to adopt.
Adopt number 11 on page 78.
There is an additional page in the blue packet for your consideration. Page 25 is a language restricting funds pending submission of a report from DHS and MDH confirming they have performed activities as required by the health article.
I would move to adopt blue page 25.
Adopt color page 25.
Moving back to the white packet on page 79 for DHS Child Support Administration. Recommendation 1 is to reduce $679,639 in federal funds for non-custodial parent employment and training contracts that we believe was double budgeted. The agency disagrees, stating that it is not double budgeted and will expand services.
Move to adopt.
Adopt number 1 on 79.
Recommendation 2 on page 80 is to adopt narrative requesting 3 periodic child support performance reports, and the agency concurs.
Move to adopt.
Adopt number 2 on page 80.
Recommendation 3 on page 81 is to request a report on the reconciliation of child support reinvestment funds, and the agency concurs.
Move to adopt.
Adopt number 3 on page 81.
Recommendation 4 on page 82 is to reduce the special fund deficiency appropriation for fiscal 26 for call center services. The agency disagrees, maintaining that the fund split must be maintained and funds are needed for additional initiatives.
Move to adopt.
Adopt number 4 on page 82.
Actions related to the Family Investment Administration begin on page 83. The first recommendation is to delete the funds for the SNAP Nutrition Education Program, which was repealed by the One Big Beautiful Bill Act. The agency concurred.
Move to adopt.
Adopt number 1 on page 83.
Recommendation 2 was to delete funds that were intended to be used to implement departmental legislation. However, with the legislation withdrawn, the agency concurred, but supplemental budget number 1 already withdrew these funds, so you would want to reject this item.
We concur with DLS. We'll move to reject.
Reject number 2 on page 83.
Recommendation 3 is to reduce the SNAP benefits to better align with the anticipated spending. The agency disagreed.
Move to adopt.
Adopt.
Recommendation 4 on page 84 reduces the federal fund appropriation that corresponds to the additional general funds that are provided for the SNAP administrative match, which changes beginning October 1st. The agency concurred.
Move to adopt.
Adopt number 4 on page 84.
Recommendation 5 on page 85 is the annual language that restricts the funds in the assistance payments program. To that purpose, the agency concurred.
Move to adopt.
Adopt number 5 on 85.
Recommendation 6 that begins on page 85 but is really on page 86 and 87 is effectively annual language that restricts funds pending submission of quarterly reports on application processing times, denial rates, and case closures, and the agency concurred.
Move to adopt number 6.
Adopt number 6 on 86.
On page 88, recommendation 7 is language that restricts funds pending submission of the calculation of the Maryland minimum living level, including the benefit increases that result and the timeline for the effective date, including any explanation for a date beyond October 1. The agency prefers a December 1 due date.
Move to adopt.
Adopt.
Recommendation 8 that begins on page 89 and continues on through page 91 is narrative requesting information on the Sunbucks participation and administration, and expresses intent that the funding for the administration be allocated among sub-objects. The agency concurs in part, preferring a January 1 due date.
I'd move to modify and extend the due date. What do you think, December 15th?
I think that works.
15th.
Move to adopt the modification of the due date for December 15th.
On page 91, recommendation 9 reduces funds from fiscal 2026 that were from the Fiscal Responsibility Fund for the SNAP benefits during the shutdown that were not needed, and the agency concurred.
Move to adopt.
Adopt number 9, page 91.
Recommendation 10 begins on page 92 but continues on to page 93. It reduces the federal funds that were part of a deficiency appropriation for the employment and income verification contract that the agency had indicated was overstated. However, they disagreed with the recommendation, indicating they needed the funds for the contract.
Move to reject.
Reject number 10 on page 92.
There's one additional item for your consideration on page 26. This language restricts funds in DHS pending a report with detailed strategies on their plan to reduce their SNAP error rates, as well as the outcome of appeals of the federal fiscal 2023 and 2024 penalties, as well as whether there was a penalty issued for 2025.
Move to adopt color page number 26.
Adopt color page 26.
The Office of Home Energy Programs starts on page 94 of the white packet. Recommendation 1 is to reduce general funds for personnel expenses. The agency concurred with the recommendation.
Move to adopt.
Adopt number 1, page 94.
Recommendation 2, starting on page 94, is a language restricting funds pending submission of a report providing application processing times and denial rates for energy assistance. The energy requests a due date of January 31st, 2027.
Move to adopt.
Adopt number 2 on page 94.
Recommendation 3, starting on page 95, is a committee narrative requesting managing for results data to include vulnerable and general participation rates. The agency concurred with the recommendation.
Move to adopt.
Adopt number 3, page 95.
Next is the Department of Housing and Community Development on page 97. The first recommendation is to reduce funds for the Montgomery County Facade Refresh Program that could be fully or partially replaced using general obligation bonds. The agency was okay with using bonds, but requested the full funding.
Move to reject.
Reject number 1, page 97.
Items 2 and 3 on 97 going on to 98. These are two pieces of language that are technical. They just make the contingent language in the budget bill more applicable to the correct FERPA provision.
I would move to adopt both number 2 and 3. On our
97.
white packet number 97.
Adopt number 2 and 3 on the white packet, number 97, going on to page 98.
Is there anything else? I would move adoption of the committee report.
There's been a motion to move the adoption of the committee report, and it has been seconded. All those in favor? Aye. Opposed? Motion approved. Thank you all, and look forward to seeing you Thursday.